Hi everyone, our presentation will be discussing the different connected projects that happened at Together for West Philadelphia this summer. The student interns for this presentation are Chris Guru, Harshita Kandarpar, Mary Beth McLaverty, Morgan Novakovic, and Christine Phillip. Our community internship site this summer was at Together for West Philadelphia. This organization's mission is to facilitate collaboration within West Philadelphia among community, public, and private sector stakeholders to foster shared projects in order to maximize impact in the areas of health, education, food access, and opportunity. For this project, we collaborated with Block by Block West Philly to research and confirm availability of local resources accessible to the community. Block by Block is a network of neighborhood volunteers who highlight services such as COVID testing sites, food access, senior well-being, childcare, and other public benefits and services. In doing this, we came to better understand the 5 zip codes that encompass West Philly and produce a revised newsletter that awaits distribution. Together for West Philadelphia is partnering with Penn Dental Medicine to educate community members of West Philadelphia through Zoom presentations. This will allow for a more proactive approach to keep good oral hygiene among the Philadelphia community. The best part about this partnership is that it will definitely be almost lifelong. Students will be getting credit in their courses, so each year there will be a guaranteed group of educators. In addition, we will always be able to find community members who are willing to learn more about oral hygiene, so this partnership has endless possibilities. There are also many different ways to keep these presentations interactive and engaging, which we plan to do. The Pettaway Pursuit Foundation wanted to assess how their Doula by My Side program was impacted by COVID, so interns scheduled time to interview either as an assigned doula or member by phone or video chat. The responses were shared back with the foundation so they would be able to compile the data to write an article at a later date. With each interview, there were many themes that stuck out. Both the doulas and the members had to adjust to utilizing these services through virtual means. It became hard for some doulas and members to make emotional connections. Some doulas mentioned they had to work outside of normal work hours to answer text messages from the members. A big obstacle to the doula services was the fact that some hospitals did not allow doulas as part of the care team during labor. Many of the members felt that despite these changes, the doulas were still a vital part to their pregnancy. Many women deal with blood pressure issues during and after their pregnancy, which can lead to an increased risk for cardiovascular events later in life. To help address this issue, we came up with 2 programs. One is an education program where the cardiology team at Mainline Health will give a presentation to the doulas of the Doula by My Side program that educates them on hypertensive conditions during and after pregnancy. The doulas will then be able to educate the mothers about these conditions and be able to recognize when a mother has been diagnosed. The cardiology team will also create a short 5-minute video for all the mothers in the program that educates them on perinatal hypertension and its role in long-term heart health. The second program involves a partnership with Together for West Philadelphia. Mothers diagnosed with hypertensive issues during pregnancy may not follow up with their primary care provider or even have established care with one. The doulas can refer these mothers to a community connector at the organization who can then connect the mother to her primary care physician for follow-up on her hypertension or help her establish care with one. Through these programs, we hope to increase awareness and educate mothers and doulas on these important issues to help promote long-term heart health. The Pettaway Pursuit Foundation wanted to create a curriculum for their doulas so that they would be able to better support their members, who are the mothers going through pregnancy, childbirth, and the associated emotional and physical changes, as well as potential risks. 5 of us BTG interns researched several topics covered in the curriculum, such as bereavement care, equipment used on babies in the NICU, and hormonal changes, for example. We have created a draft and are working on finalizing this curriculum so that doulas are better equipped to serve mothers during and after pregnancy, as well as serve as a liaison between medical providers and mothers who may not be aware of medical jargon surrounding their own health as well as the baby's health. A future goal of this curriculum is to encourage mothers to access primary care providers and seek appointments for screening, so as to reduce childbirth-related health risks in the future. It is also to encourage doulas to have a resource to provide the best emotional support and care outside of medical care that can to the new and expecting mothers. And in summary, our many results of these projects is an updated block by block West Philly newsletter with available resources, developing a program with Penn dental students to educate the community about oral health, doula interviews, which will be compiled into an article assessing the effects of COVID on these services. We also outlined a protocol for the Pettaway Pursuit Foundation, Together for West Philadelphia, and Mainline Health Cardiology to collaborate and educate doulas about cardiovascular issues facing pregnant women. And we developed an initial curriculum to prepare doulas and to improve birth outcomes with evidence-based research. And a reflection from our interns over this summer are as follows. This summer allowed me to work with a diverse group of people and organizations that have expanded my knowledge and motivated me to continue to expand it through the rest of my career. Being able to personally understand the Philadelphia community has allowed me to grow and understand all walks of life and the difficult times individuals go through. This experience at Together for West Philadelphia challenged me to rethink what it means for a person to be healthy and showed me how invaluable collaboration between different health professionals can be. This summer with BTG allowed me to explore many different aspects of community health that I had not thought of before, but will carry with me into my career indefinitely. I had the opportunity to collaborate with peers and mentors from diverse backgrounds and professional disciplines, as well as organizations doing impactful work. I am motivated to continue learning about social needs surrounding healthcare to best serve my future patients. Thank you.